Hi, my topic is acute hydrophilic-Polymer neuropathy and acute renal failure. My name is Oscar Yupabuñay, Medical English, Dr. John Moscoso. Definition. Hydrophilic coatings are used on intravascular devices to facilitate manipulation and to minimize complications such as vasospasms during a procedure and thrombosis after a procedure.
Kidney failure can happen sort of in sort of two broad sort of temporal categories, and there are variations in between. But you know, some people will have a chronic disease, diabetes, high blood pressure, polycystic kidney disease, that causes slow damage to their kidneys over time. In certain circumstances, there can be sudden insults to the kidney. Um, Typically, very sudden drops in blood flow to the kidney related to low blood pressure. Sometimes toxic substances can affect kidney function, and this is a sudden thing, and that's why it's called acute renal failure or acute kidney failure, sometimes called acute kidney injury. But it's all describing the same process. A sudden impairment of the kidneys functioning. Sometimes, if we catch it very early in terms of impaired blood flow to the kidney, we can actually treat that before there's been, intrinsic damage to the kidney, and we can reverse it very quickly. Sometimes, if that proceeds long enough, and also with toxic agents, there's not uncommonly some actually damage to the kidney tissue itself. In many cases, that's reversible. Not always. Most cases of acute renal failure are reversible, but it typically happens in people that are relatively sick. It's a frequent complication of other situations. Someone's sick for some other reason, and their kidneys get injured sort of as an innocent bystander. And in those situations, though there's the potential for recovery usually doesn't occur until the patient as a whole begins to recover. In those situations, sometimes there's kidney impairment, but it's not severe enough to require dialysis. But sometimes the kidneys are injured to the point where we will actually do dialysis with the hope that it's temporary. Sometimes it becomes permanent because not everybody with acute renal failure recovers. But many people do. And in those situations, we're doing dialysis primarily as a bridge. The dialysis doesn't make your kidneys better. It doesn't make your kidneys worse. It simply takes the place of your kidneys until your kidneys can recover.
Application in medicine. The patient underwent renal transplantation in which the renal artery was implanted into right external iliac artery. Between January and June 2013, her serum creatinine level increased progressively over a 5-month period.
Welcome to part 2 of acute renal failure. There is catabolic effects, steroids, all that. What are some things that can decrease it? Well, liver failure. Okay. And then what about proximal convoluted tubule? We see that it parallels the reabsorption of sodium and water. And so we know that it's reabsorbed. Okay. And so because of that, in a low flow state, it's going to be really absorbed. It's going to go up. Okay. Now, what about creatinine. All right, we know that it's the end product of muscle and that it is filtered and secreted. Okay, so what are some things that can increase it that have nothing to do with the kidney function? We know that it can be increased by drugs that prevent its secretion in the kidney, and that would be cimetidine and trimethoprim. What are some things that can decrease it? Muscle wasting. Okay, and we know that it goes up in renal failure. Okay, well, let's talk about the BUN to creatinine ratio. We know that because the BUN goes up even higher in a low flow state, that it's usually 20-to-1 ratio if it's pre-renal. Pre-renal, again, is any reason that causes a decrease in blood flow to the kidneys, and that it's 15-to-1 in renal. Okay, and in renal, remember, is where there's a problem with the kidney itself, and pre-renal is where there's a problem with the amount of blood flow that's going to the kidney. Okay, now,
Pros and cons. Pros. Palmer coated interventional devices are used frequently, and the diagnosis of Palmer emboli is unlikely. Since emboli usually lodge in the arterioles downstream organs. Cons. The associated events range from non-detectable events to myocardial infarction, stroke, and death within days to months. Computed tomography angiography reveals stenosis of the common iliac artery.
Hello, this is Andrew Wolf. In this video, I'm going to talk about acute renal failure. Now, I want to make a point that can cause a intrarenal failure and damage to the nephron due in both the glomerulus and the tubules. Lastly, I want to talk about postrenal failure. Now, with postrenal failure, you need to think about urine that has flowing freely from the nephron and into the renal pelvis and down the ureters to the bladder, and then from the bladder out the urethra. So post-renal failure is caused by something that disrupts this flow. Most commonly, it is caused by renal calculi or kidney stones that can clog up the ureters or the urethra itself and cause a backflow of urine into the nephron. It also can be caused by masses like from bladder cancer, or it can be caused by masses in or around the urethra, compressing on the urethra, like severe benign prostatic hypertrophy or prostate cancer. Now, anything that disrupts the flow of urine from the renal pelvis will cause a backflow or back pressure in the nephron. And if you have significant back pressure in the nephron, if you trace it all the way back up to Bowman's capsule, and you increase the pressure enough in Bowman's capsule, then you no longer have a net filtration pressure, where you have a much greater pressure, hydrostatic pressure, coming from the glomerulus and pushing fluid across the membrane into the Bowman's capsule. Remember, because on the urethra, like severe benign prostatic, filtration pressure is caused by a difference between the high pressure in the glomerulus and the low pressure in Bowman's capsule. But if you increase the pressure in Bowman's, if you have significant back pressure in the nephron, if you do an ultrasound and you find someone with a big kidney stone that's blocking the ureters, then you can quickly intervene and take care of the problem, and you're done. So always consider it, even though it's probably the least common that cause of acute renal failure. Then you, and I'm not going to get into the details here, but there are ways to differentiate between whether it's pre-renal or intrarenal. If it's pre-renal, you're going to consider, is the patient on NSAIDs or do they have decreased volume or both? If it is intrarenal, then you are going to decide, okay, does this patient have ischemia, or are there drugs or toxins that are potentially causing injury to the epithelial cells of the tubules? Okay, so this concludes my video on acute renal failure. I hope this was helpful to you.
See a plate in Ecuador. These renal lesions may be induced by Hydrophilic-Polymer emboli. We speculate that the stent in the iliac artery was the most likely source of the emboli, in light of the anatomical proximate to the anastomosis.
I am Dr. Vishwanath, consultant nephrologist and HOD nephrology. I am working at Manipal Hospital, Bangalore. Acute renal failure is what is also called as acute kidney injury, because it is called acute kidney injury because most often any injury will recover. So acute kidney failure also will recover. 99% of the times acute renal failure means it is acute renal shutdown, where whatever has caused kidney failure, once it gets better, kidney will improve. The most common causes of acute kidney failure is in an ICU setting where blood pressures are low, they have some infection, where there may be significant involvement of the kidney. Once we treat it appropriately, it will get better. The other most common causes of acute kidney injury are significant blood loss. Somebody has road traffic accident, loses a lot of blood, or they have significant low blood pressure, which may lead to acute kidney failure. As I said, 90 to 99% of the times, acute renal failure, if it is picked up early, treated appropriately, can be definitely prevented, and most often these individuals, the kidney function gets back to normal, what it was in the original state. Chronic kidney disease is the one where there is a relentless progression. It's a permanent kidney damage and more or less irreversible kidney damage. If we detect it early, definitely we can do something to prevent.
Conclusion. In conclusion, the current case highlights what we consider to be an underrecognized iatrogenic complication. Embolic fragment material may be present in patients who have undergone recent ablation of an intravascular device with a hydrophilic coating.
When Howard Hughes was 19, his father died, leaving him in charge of the Hughes Tool Company. He dropped out of Rice University and decided to use his wealth to make movies. His movie Two Arabian Nights won a 1928 Academy Award, and Hell's Angels won a 1930 Academy Award. He then bought RKO Studios in Hollywood and later sold it for a $6.5 million profit. He learned how to fly, set several flying records, and formed the Hughes Aircraft Company. In 1938, he set the record for the fastest flight around the world at 91 hours. In 1946, he built the largest airplane ever made, the H-4 Hercules, also known as the Spruce Goose. He bought TWA, or Trans World Airlines, and established the Howard Hughes Medical Institute. He moved into real estate, and one day when staying at the Desert Inn in Las Vegas in 1966, he was asked to vacate his room. Well, he didn't want to leave, so instead he just bought the hotel. He then spent the next 10 years buying and living as a recluse in hotels throughout the world. For the last 4 years of his life, he lived in penthouses of his hotels, the Xanadu Princess Resort in the Bahamas and the Acapulco Princess in Mexico. He had hip surgery in 1973, and afterwards he chose to never walk again, living entirely in his bed. He became increasingly eccentric and stopped bathing, cutting his hair, and cutting his nails. He had chronic pain that resulted from a plane crash that he was in when he was test piloting years earlier. From that, he became addicted to codeine, and he would self-inject codeine into his muscles. He developed weird eating habits and began to lose weight, eventually weighing only 90 pounds. Well, the codeine alone wasn't enough to control his pain, so he started taking more and more aspirin to the point that he was taking 20 to 30 aspirin tablets a day. In April 1976, he became dehydrated, and that, on top of his enormous aspirin use, led to acute kidney failure. He refused all blood tests and x-rays. His doctor arranged to fly him from Mexico to Houston to get treatment, but he died before the plane could leave Mexico. Because it was common at the time for countries to hold corpses as ransom so that estates could not be settled, the pilot didn't announce Hughes's death until after they entered U.S. airspace. The cause of death, acute kidney failure. Well, Howard Hughes is one of the more bizarre cases of acute renal failure, but acute kidney injury is extremely common, and I see it virtually every day in our ICU. Today on MedNet, we're going to look at acute kidney injury from two unique perspectives. First, to tell us how acute kidney injury is actually a multi-organ system disease, nephrologist and assistant professor of enteral medicine, Dr. Uni Bhatt. And then to tell us about the emerging field of onconephrology, assistant professor of enteral medicine, also from the Division of Nephrology, Dr. Jason Prozek. Uni, Jason, welcome to the program.
Thank you, Jan. Thank you.
Well, Uni, dehydration and aspirin knocked out Howard Hughes' kidneys. What are the most common causes of acute renal failure in a typical hospital practice?
Again, very similar to Howard Hughes' story. Probably dehydration is probably the most common thing, whether it be associated with other illnesses such as gastroenteritis, acute bronchitis, things like that, that decreases oral intake. That in addition to nephrotoxin exposure, such as with, again, non-steroidal anti-inflammatory drugs like aspirins, ibuprofens, etc. Those are probably the most common things that we see.
Well, Jason, why are nephrology and oncology so tightly intertwined?
Thank you, Jim. So we are seeing that in a cancer hospital, 15% of all hospitalizations have acute kidney injury as one of their admitting diagnoses. That is 3 times higher than the background rate for non-cancer patients. Of that population, 50% had hyponatremia, and many patients will resultantly have chronic kidney disease simply by surviving their cancer chemotherapy treatment. So there are nephrologic complications along the whole spectrum of cancer treatments.
Well, thanks, Jason. Let me remind you that you can email us with your questions about acute kidney injury using the email feature on your MedNet webpage. And now let's get started with a look at the epidemiology and clinical consequences of acute kidney injury. Uni?
Thank you.